coroner's concluded that there were missed opportunities to bring 20-year-old Luke Abrahams to hospital when he suffered from sepsis. We can hear now from his brother Jake, who is about to speak in Northampton. Let's cross there now.
Hi, I'm Jake Abrahams, Luke Abraham's younger brother. I would like to start by saying today is the 3rd anniversary since Luke passed. Little did we know that that was just the beginning of the nightmare. We have had to fight every minute of every day since then to get answers. We even had to fight for this inquest, the hospital having told the coroner that Luke died of natural causes. We can never forgive the NHS for letting Luke down. He should still be here today, and we can never forgive them for the way they have treated us ever since. Having to fight for every detail with the solicitor, having to fight for every detail with the help of our barrister, Layla Ben-Yunus, and solicitor, Elizabeth Maliakal, at the Hudge Hill Solicitors. We are so grateful for them and to have them for support. 3 years on, and the pain has not eased. Time is not a healer. If anything, it has deepened. Luke should still be alive, living his life, playing football, laughing with his friends, planning his future. Instead, we are left with an absence that never goes away. Had Luke been taken to hospital and received the appropriate treatment at the right time, he could still be with us today. That is what the evidence has shown. A fit, healthy 20-year-old boy, not simply die like this. Not in a modern country with well-developed medical facilities. It is simply not good enough, and they have left a shattered, broken family in their wake. Luke was badly let down by the NHS, and our family is forced to live the consequences of that failure for the rest of our lives. Our hearts are broken. Every day is a struggle. Some days it feels almost impossible to keep going, but we do for Luke. And for myself, who I've not only just lost a sibling, I've also lost a best friend. Luke's an extraordinary young man. He was popular, friendly, funny, and deeply loved. Football was his passion, but people were his strength. He brought joy wherever he went, and he had so much to give. We miss him each and every day. In big ways and small ways, in the silence and in the milestones he will never reach, in the future that was taken from him and us. Sitting through this inquest has been harrowing. Hearing in detail how Luke could have been saved, how he should have been saved, is the most painful experience imaginable for any parent. Luke came down with what seemed like nothing more than a sore throat, like we all do in winter. But within a week, just 1 week, he was dead. All the evidence we have heard this week points to the same devastating conclusion. With proper recognition and timely treatment, Luke would still be alive. When mistakes are made in the NHS, the consequences can be fatal. Lives are lost, families are destroyed. That cannot simply be dismissed as one of those things. There must be accountability, there must be justice for Luke. And there must be meaningful learning so that awareness of a rare but deadly disease and conditions like this are aware. Luke is improved, and so that no other family to endure the pain we now carry every single day. We will not stop campaigning until we are sure those lessons are well and truly learned. We are grateful to the coroner for the thoroughness of her investigation and for helping us to get the answers that we should have had a very long time ago. Now, as we reach the end of this inquest, we are left to find a way to go on living, carrying Luke with us in everything we do. We will continue to do the best we can to honour his memory and to live our lives in the way that would make him proud. But nothing will ever change the simple truth that Luke should still be here, and our lives will never, ever be the same without him. Thank you.
Thank you. Well done. Happy to take any questions.
How will you remember him?
To put it simply, I think the only way I can describe my brother is an inspiration. I think being a younger brother to Luke, everything I've learned to this day, I've learned through him. I think he had a crucial part in my life, and yeah, to put it simply, I think a bit of my heart's been missing with no longer having not only a brother, as I mentioned, but also a best friend.
Right, can I ask, what action will you be taking after this?
So thank you. Yeah, I'm Rad Seeger. I'm the family advisor and spokesperson. It's been a devastating 3 years for this family. It's been a painful week. There's lots of lessons that can be learned. Going forward, they've got a very good civil claim where they will be able to prove that had Luke had timely treatment, that he would have survived. But what's more important for this family is that lessons are learned. And we heard the coroner today say that she's going to issue a prevention of future deaths report. On the NHS website, it isn't clear what necrotizing fasciitis is. And although it's rare, it could happen to any of us. So the family should be very proud that they fought this hard to get to this point. So it's really about leaving a legacy for Luke and making sure that his death was not in vain. So yeah, there's still quite a lot to do.
If I'm honest, I just want someone to realise that there shouldn't be errors made in result of a death of a human life. Not only has it affected me and my family, all of these people here today and the people that couldn't make it have also been affected due to the massive community he had. So therefore, we just want it to not happen to any other family or friends.
Okay, thank you very much. Thank you all for coming. That's all right.
Well, that was Jake Abrahams talking about his big brother Luke, who is pictured on your screen right now, who was just 20 years old when he died 3 years ago this month from sepsis. He'd been ill for only around a week, but there was a missed opportunity, the coroner has said, to convey him to hospital. They haven't been able to say, though, whether any earlier treatment would have changed the outcome, and therefore the coroner in the death of the 20-year-old has given a narrative conclusion. As you may have picked up on the end there, a prevention of future deaths report will also be made to change the wording on the NHS website. Now, the wording currently says that necrotizing fasciitis, this pretty devastating infection, is caused by an external wound, but that was not the case for Luke Abrahams, and that's what they would like to see change. And of course, we heard his younger brother there saying so much about him. They were best friends, but also the fight to stop this happening to anybody else.